Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, then the next staging system is Barcelona Clinic Liver Cancer Staging System. According to Barcelona Clinic Liver Cancer Staging System, it is developed to allow for induction of best therapy. It is used for indication of best therapy for each stage of hepatocellular carcinoma. It indicates the best therapy for each stage of hepatocellular carcinoma. So, this Barcelona clinic liver cancer system will indicate the best therapy for each stage of hepatocellular carcinoma. So, thus, it is best. This staging system is best used for the treatment guidance of the patient and to select the early stage patients who will have benefit with therapeutic therapies. Like if you do some therapies or some techniques in early stage patients, how well they will be benefited by that technique will be prognosticated with the help of this Barcelona clinic liver cancer staging system. This will divide the patients into, actually it will consider for some of the parameters, and it will divide the patients into four groups: early group, intermediate group, advanced and end stage group. So it considers the following variables. It considers the following components. So if you see the components of Barcelona score are, it takes into account the tumor size, liver functional status, physical status and cancer related symptoms. So it takes into account the tumor stage, liver functional status, physical status and cancer related symptoms, and then it will divide the patient into four major groups like early stage, intermediate stage, advanced stage and end stage liver disease.
thank you and thank you for watching.